And so future directions for the management of heart failure. So in 2014, a study was published looking at the combination of an angiotensin receptor blocker and a neprilysin inhibitor versus an ACE inhibitor, enalapril alone, was published. And this was one of the very few studies in the last 20 years that's shown a substantial change in heart failure survival with the medicine. And so this medicine is commercially known as Entresto, and it's a combination of valsartan and a medication called sacubitril. And we know what the role of angiotensin receptor blockers are, ACE inhibitors are, as far as reducing vasoconstriction and probably having some reduction in fibrosis as well. The addition of the neprilysin inhibitor also allows for improved diuresis, natriuresis, vasodilatation, and perhaps decreased myocardial remodeling. And so the addition of a neprilysin inhibitor really augments the role of the angiotensin receptor blocker. And in the study called Paradigm, the one that was published in 2014, what we see is that there was an absolute risk reduction of 4.7%, with a 20% decrease in the primary endpoint, which was a combination of death and heart failure admissions. The number needed to treat with Entresto was 21. I'm thinking about death from a cardiovascular cause. The absolute risk reduction was 3.2%, and the number needed to treat was 32. So these are actually very positive numbers, a pretty significant difference with the treatment. The adverse effects were hypotension, and angioedema was similar between enalapril and Entresto. So Entresto is now recommended by the American Heart Association and the Heart Failure Society of America as an appropriate treatment for patients who can tolerate the medications who have systolic heart failure. This is all for systolic heart failure, not so much for diastolic heart failure. Evadrabine is a medication that has a role where it is an inhibitor of funny channels, and it can decrease heart rate without having a decrease in contractility as opposed to beta blockers. So for patients who are on beta blockers who still have an elevated heart rate, not because they're in a low output state, evadrabine was shown in the SHIFT trial to improve survival as well. So in selected patients with high heart rates in heart failure who are already on beta blockers but can't tolerate anymore, evadrabine is another medicine that we're starting to gain more and more experience using. There's ways to monitor patients from home using invasive tools. So this one is called the CardioMEMS device, where a little sensor is placed in the pulmonary arteries, and it gives measurements of the pulmonary artery pressures from the patient's home if they're hooked up to this electronic unit, which has been shown to reduce hospital admissions and may allow just an additional data point for providers to take care of their patients. And finally, if our treatments to try to prevent heart failure from worsening or from developing at all fail, there are increasing numbers and increasing efficiency of advanced heart failure therapies like left ventricular assist devices and improving ways of transplanting patients as well.